Hello, my name is Dr. Vikram Gupta. I'm a practicing physician in New Jersey, and today we're going to talk about the craze about this new weight loss medications called the GLP-1RA, which is GLP-1 receptor agonist. The talk of the town about weight loss and how they've been flying off the shelves, but people do have a lot of questions and hesitations and excitement about this drug. So we're going to talk more about this, about the pros and cons, and is it the right medication for you? So let's get started. Glucagon-like peptide 1 receptor agonist. Basically, this is a medication that helps control diabetes as well as promote weight loss. So this is a new class of medications that has been around for some time but actually came to the limelight recently. These are called GLP-1 receptor agonists. So these are basically glucagon-like receptors that are present in the pancreas and in the brain. What they usually do is, in general, trigger the pancreas to make more insulin, and also helps the brain understand when the stomach is full and when it's not. It's like, you go to a restaurant and have some bread as appetizers, and suddenly after that you're like, okay, I think I'm pretty full right now. This is where the brain telling you that I think we're full. Now, these medications, what they do is trigger these receptors ahead of time, so the body makes more insulin to use the sugar that's in the body, and also tells the brain that we are full. Now, when people started using this medicine, this class of medicines, they noticed that a lot of people were losing a lot of weight, and they realized that when people start feeling full, it also means that they don't feel hungry. And when they don't feel hungry, they don't eat. And when they don't eat, their sugar comes down, and in the process, if you're not eating much, you are going to lose weight. So recently, the FDA actually approved this medication for non-diabetics as well as a legitimate weight loss drug. And since then, people have been losing weight left, right, and center, and the results have been phenomenal. Now, people with diabetes and without diabetes can use this drug to help them lose weight. Your sugar will not drop if it doesn't cause the sugar to drop, as people think, like, as sometimes they have what we call hypoglycemic episodes in diabetics. But this one doesn't work like that. It just makes you feel full all the time, and as a result, it's a prolonged intermittent fasting kind of state where you're not hungry, and if you don't eat when you're not hungry, you are basically eating less. Eating less means weight loss. So these drugs have been out for many years, maybe more than 5 years, if not longer, but they were primarily used for diabetes. They've only been available as injectables. It started as once a day injection, not insulin, but this medicine was in an injectable form, and it was one of the medications we use to treat diabetes. Then later on, they came out with once a week injectable. So one injection is given once a week, and you're good for about a whole week. And now recently, they even came out with tablet forms of this medicine, but they all technically, for the most part, work the same and serve the same purpose. So for our conversation, we're going to leave out the oral form for now, and we'll stick to the injectables. That means an injection is given once a week and keeps you feeling full for the most part, and helps you eat less, and as a result, you lose weight. Studies have shown that people will lose anywhere from 4 to 7% of their body weight. So if you weigh about 200 pounds, you may expect to lose about 10 pounds to 15 pounds. And it happens rather quickly over a period of a few weeks. But the question is, how long is it sustainable? And in general, some people will lose less weight and some people will lose more weight. But over about 3 to 4 months, people have maintained a weight loss of about 10 to 15 pounds. Obviously, if you weigh 300 pounds, your weight loss in percentage is likely to be more. But then it tends to plateau, and my patients have increased the dose because the body gets used to that, and the hunger receptors still do kick in. And so the dosage adjustment is done over time, but for the most part, that's the kind of weight loss that can be expected over time. There are a few injectables out in the market. They're called Ozempic. That's the one getting the most popularity right now. But then there's also Trulicity, Victoza, Vygoby, Bydureon, and recently introduced Mounjaro, Mounjaro. Now, these are all similar in action, and they have certain nuances and certain mild side effects that are more characteristic to one versus another, but the big picture is pretty much the same. They get you from point A to point B. These drugs are only available by prescription by your doctor, and you cannot buy them over the counter. Can people who do not have diabetes use these drugs? Yes, it turns out that initially it was only approved for diabetics, but now people without diabetes can also benefit from this medication. And the side effect profile is pretty much the same whether you're a diabetic or not, although the diabetics benefit more because it's helping them control their diabetes and get healthier. With the non-diabetics, it can prevent them from developing diabetes because they will lose weight, and as a result, the chances of developing diabetes is lesser, because diabetes develops due to various other reasons and not just gaining weight. But it's a great drug that's out on the market for control of diabetes and for weight loss. People start to lose weight rather quickly with the GLP-1s, and the effects you can start seeing within about a week or two after starting this treatment. And the injections are given by patients themselves. It comes as a pen, and everything is rather simple. This is the most common question that I get asked: what are the side effects with this? Now, most commonly reported side effects are what is quite common to most medications: nausea, vomiting, diarrhea. But mostly what my patients have been reporting is a feeling of fullness. That's what these medications tend to do. And if you feel full, then you're not hungry. Most patients have experienced nausea with this, and sometimes even vomiting. Diarrhea I have seen less frequently, but it is one of the side effects that's listed, so one would try it and see how their body reacts to it. But in general, the most common issue that we encounter is nausea and vomiting. Now, why does this happen? It's basically if it creates a sensation that your stomach is full. Now, if you've ever eaten a lot at a party or something, and you feel your stomach is full up to your neck, it's basically, you can imagine having that sensation pretty much all the time. Now, obviously, it's dose dependent, so if you are on a lower dose, then you may just not feel hungry. But if the dose is a little high, then that sensation is more exaggerated. Now, sometimes what happens is people stick to their regimen of like, oh, it's lunchtime, so I'm going to have my sandwich, and this medication will help me lose weight. Well, the medication is helping your brain understand that, okay, we are actually full. It gives a false almost, you can imagine, it gives a false signal to your brain that the stomach is full. But when people still eat a whole sandwich, like a meal that they would otherwise eat, then that nausea can turn into vomiting because the brain thinks that you've had way too much to eat. And it can. trigger that. Now this is just to help you understand. It's much more complicated than that, but that's the idea. It also, what it does is slows down gastric emptying. That means the food that's digested in the stomach, it stays there longer than it usually would. So if you ate a sandwich for lunch, and you would think that, okay, you're going to be you might feel a little hungry or less full after a couple of hours. But in this case, this time that food stays in your stomach can actually stay there longer. So not only it tricks your brain, but if there is any food in the stomach, it kind of lets it stay in the stomach longer. And the stomach also has receptors in it. When the stomach expands with food, what it'll do is those receptors tell the brain that the stomach is full now, and we can stop eating. Now, a lot of times if we're eating a certain meal, we are able to bypass that feeling and overeat, which is a problem with pretty much all of us. But you have to be aware how this medication is working so you can understand and allow it to work the way it should and not try to beat it. So that's the idea why people tend to have these relatively common side effects. Now, the other side effects are when it's not a good medication for you or it's not the right drug for you, then that you should discuss with your doctor and they can go into details, keeping in mind what other medical problems you might have and tailor it to your needs. So having a medical professional who is looking out for your overall health and not just weight loss is essential. If you have any further questions regarding the GLP-1 RAs, please talk to your doctor, who can always help you tailor these medications to your particular needs. And please don't forget to comment, like, or subscribe to this video, and I'll see you with the next one.